Qualified, professional, and compassionate doctors talking real solutions to real health problems.
Do you have an abnormal discharge or itchiness or a wound in your genitals? Did you know that genital infections are among the common reasons a person would make a visit to the doctor? With me in studio is Dr. Chigundu Spire and Dr. Sematimba Kato from Henrob Medical Center to tell us more about genital infections and all the misconceptions surrounding that. So most welcome to the show, doctors.
Thank you.
And again, I'm your host for the evening, Dr. Darius Owachi. So without wasting further time, let's dig into understanding more about these genital infections and all the myths surrounding it. So maybe we'll start with you, Dr. Chigundu. You know, genital infections are quite a sensitive and potentially embarrassing issue in couples' lives. And there are lots of myths around it. So just give us an idea, what exactly are these genital infections that are causing these unpleasant symptoms?
Genital infections are infections that affect the genital tract, that is male and female.
Okay.
And urine tract infections are infections that affect the urinary system. Sometimes people confuse the two.
Actually, that was going to be the next question. What is the difference between the genital infections and the urine infections? Are they the same? Most people think they are the same. So I want to know tonight, are these the same terms?
Certainly they are not the same, though in men there is an interlinkage of the two, because the genital system in a man serves both as a urine tract system. Okay. So most infections that affect men usually go through the tube that passes urine, what we call the urethra, and it is the same tube that we use for genital purposes. Okay. So genital infections and urinary tract infections in men are more like almost the same. Okay. But in females, genital infections are different from urine tract infections. Okay. Because the systems are quite separate. Yes, and commonly urine tract infections will affect the tube that passes urine, what we call the urethra. Then the infection ascends slowly, if untreated, into the bladder. That is what we call cystitis. Okay. Then from the bladder, if unattended to, the infection will ascend to the tubes that carry urine from the kidneys, and we call those ureters. And eventually, the infection can spill over into the kidneys.
All right.
So that is the track of the infection in
that
the
is the urine system.
Yes.
Whereas the genital system refers primarily to the reproductive system. Yes. So saying in men, where is the linkage? Because you say the two are interlinked. So where is the linkage in men? The reproductive and the genital system and the urinary system.
You know, the male system essentially. The tube that carries urine, what we call the urethra, plays real double purposes in a man, because it is the same tube that carries semen. Okay. The only difference is that the genital tract in a male ends into the testis, but the urine system, still from the bladder up to the kidney, is different. So they join at the point of the bladder.
At the point of the bladder.
Yes.
So that's why the interlinkage is. All right. So Dr. Sematimba, now the big question is, most people commonly think sexually transmitted disease, which is primarily a genital infection, is the same as a UTI. Why is this so, and what is the difference between the two?
Genital tract infections affect the genital system, or the system used for reproduction.
Okay.
So the system used for reproduction is quite different, or could have some similarities with the system used for collecting and passing urine. So because of the small differences and similarities, it brings some confusion, especially in the community. However, the urinary tract infections affect the system from urethra, bladder, ureter, and kidneys. Kidneys are the ones which make the urine. And the sexually transmitted infection, like it appears, they are through contact during sex. They are transmitted through contact during sex.
So how about the UTIs? How would the UTIs now be acquired or got? If you're saying the systems are different for the genital infections, it's primarily during the act of the reproduction, right? The sexual act. So UTIs, how do they come about?
Now, urinary tract infections could also be due to acquisition of microorganisms or bacteria that can essentially ascend from urethra upwards. So we usually pick these microbes or microorganisms from the environment, and then they get their way into the body, and then they access the tract, which will lead. When these microorganisms, sometimes the system clears them, but sometimes they overwhelm the body and they cause disease, and we get urinary tract infection. The commonest being infection of the bladder, which is called cystitis.
So regarding genital infections per se, Dr. Chigundu, what are examples of these genital infections? Now you're raising people's curiosities. They thought UTIs were the same as genital infections, but they're not. So which are the examples?
Genital infections, as we elaborated earlier, being infections of the genital tract, can be categorized into different groups. There are those which cause discharges, and under these we have candida albicans. Candida is a fungus, which is literally almost the most common genital infection that causes discharges. Then we have other infections that cause discharges, like trichomonas vaginalis. It causes a yellowish discharge, which sometimes is itchy. Then you have
Bacterial vaginosis.
Yes, bacterial vaginosis. So those essentially are the three most common.
Most common genital infections.
That cause discharges.
That cause discharge.
Discharges, yes.
Okay.
But that mentioned, there are other things that can cause discharges, which we really can't overlook. Things like cancer of the cervix, cancer of the uterus. It's very good to talk about them because sometimes women do not know that any discharge warrants to see a doctor. Every time a woman sees a discharge, you should not just think about infections alone.
Okay.
You should also think about the big ones, like yes, cancer of the genital tract. Some of these come with bad offensive discharges. But some of these infections can also cause cancer of the cervix, for example, and cancer of the vagina is caused by another group of infections, the one we call, there are some viruses. Yeah? We have the herpes, we have the HPV, especially that HPV, human papillomavirus. It is a very common sexually transmitted disease and a genital infection that causes cancer of the cervix, genital warts, and cancer of the vagina. Then you have those that gives you ulcers or wounds in the private parts.
Right. I think we'll come back shortly to explore more about these infections. It appears to be a very wide group, and we're just kind of scratching the surface and going into depth of each of the diseases. But we'll be back shortly after the break to discuss more. If you have questions regarding this topic, regarding UTIs or genital infections or STDs, we want to decipher all those myths and misconceptions around it. So send in your comments, send in your questions to us on our social media handles. We'll be happy to reply and respond to each one of them. Don't go away, stay, we'll be right back.
You are watching the Doctalk Show. You are watching the Doctalk Show.
Welcome back. In your younger days, you might have heard from your elders or from your teachers to abstain from sex, lest you will acquire sexually transmitted diseases. Well, what exactly are these diseases they call STDs? Well, our doctors in studio will tell us more. So, Dr. Chigundu, in particular regard to STDs, we know it's a type of genital infection. What exactly are these STDs?
Thank you very much. STDs are sexual acquired or sexually transmitted diseases. And these diseases actually occur from the common infections. And these common infections in our population are those infections that can cause discharges. Then we have infections that can cause wounds or ulcers.
Wounds or ulcers?
Yes.
So those are the main two.
Those are the two broad categories.
Those that cause discharges, those that cause ulcers. And among the very common diseases that cause discharges is one called candida. So Dr. Sematimba, one who posed the question, is candida an STD? One of the most common questions I'm sure you interface with your patients in the clinic.
Thank you. Is candida an STD?
Yes, because it will cause a discharge.
Well, yes.
Dr. Chigundu said to cause either a discharge or to cause an ulcer or a wound.
So I think that those are some of the myths we need to break. Candida is not an STD.
Okay, how so? Because
Candida...
there are those which are not STDs but can cause discharges.
Exactly. Now, candida being one of the commonest manifestations of a discharge, people think it's sexually transmitted.
Yes.
But candida is caused by an organism which is acquired from a fungi, which is acquired from the environment.
From the not sexually transmitted.
Not sexually transmitted.
From the environment. How does it reach? Now, how does it come from the environment?
Exactly.
Into the
the
discharge.
Being the design of the female tract, it's crowded somehow and provides that environment, culture, warmth, and all those things for this candida. It's called candida albicans to flourish. So it's basically a fungal infection that is acquired from the environment that sometimes overwhelms the body and then manifests as a whitish discharge that is like spoiled milk. Yes, usually like caddy, spoiled milk. It also causes itching, and women can itch and scratch. So sometimes it becomes red actually. It can be very uncomfortable when they itch and scratch.
But it's not an STD.
It's not an STD.
Okay, so which are the STDs then? If candida is not, at least demystified, we have thrown light that candida is not a sexually acquired infection or sexually transmitted disease.
Yes, actually, when someone has it, you don't have to treat their partner.
Okay, because most people will say if the wife has candida, the man also has to go for treatment.
Exactly.
So
maybe also to elaborate a little bit more before we go there, for the fact that candida is a very common manifestation, and the biggest reason why most of these women come to us. We need to know that candida is really more of an optimistic infection. It takes opportunity for when the immunity changes. Candida will grow. In some research, we really found out that actually most women have candida, the organism, that fungus colonizing the vagina. It is only that it is kept in check by the environment. Physiologically, a woman's reproductive tract is supposed to be acidic. Okay. And what makes it acidic is a special type of bacteria called lactobacillus, which is naturally a resident in that area. Now that bacteria, that bacteria produces a moderate amount of acid that keeps off other organisms from growing. It is normal, including candida. Right. Anything that changes the environment, that changes the growth of that organism or suppresses that organism called lactobacillus will reduce the acidity of the vagina and candida will grow.
So what are those common things that can change the woman's environment and make the candida come?
Common changes are hormonal. especially pregnancy. During pregnancy, the environment changes. The acidity reduces, the vagina becomes more alkaline, less acidic, and this favors the growth of candida, of that fungus, which now becomes a disease. Women who have immunosuppression of any sort, you can have immunosuppression because of previous disease. HIV is very common. Diabetes, when you have uncontrolled sugars, they will alter the environment, and candida is actually quite common in women with uncontrolled diabetes.
Is it true that some people think going to the toilet, you know these toilets, the public toilets, they commonly say this toilet, because of the hygiene conditions, they got candida. How true is that?
Actually, that's not true.
That's not
to be realistic, that's not true. Candida is not acquired. It could be a conduit, but we don't usually say that someone used the public toilet, they are getting candida. It's not very true.
Okay.
Yes. So it's not picked off toilet. Yes. Yes.
But somehow it is a change in the woman's environment which makes the fungus come.
You pick up from what he said actually. Some practices like douching. Douching is that ladies who clean, they go up. Yet cleaning is supposed to be where you see on top. Is it
cleaning the outside?
Cleaning the outside.
Not cleaning the inside.
They go inside, use like 3 fingers, go clean. They scrub. They go an extra mile. Actually, that changes the environment and gives room for candida to grow.
Especially using detergents.
Exactly.
Like soaps,
yes.
These hygienic products which have chlorine in them. It really alters that bacteria, kills it, and gives chance for candida to grow. Actually, we've found out recently that the irrational use of antibiotics, especially in Kampala, has caused a lot of problems.
The antibiotics.
Exactly.
Could you throw more light on that? How are the antibiotics? I know many people, like, whenever people fall sick, they will first say, I don't want to take some, azithromycin or some antibiotic. So what is the effect of antibiotics on
Incidentally, every woman in a population has used antibiotics at a certain point. Irrationally. When people have a cough, when they have a flu, when they get all sorts of illness, they will run to a pharmacy. The use of antibiotics in our country is not well regulated. Okay. Actually, antibiotics are not supposed to be given without a prescription. But most people just go and give me some ampiclox, give me some ampicillin, whatever cups of blue and black, you know.
Yes. Actually, that's for 2 days. Give me for 2 days.
Yes. So those treatments are causing the candida.
Exactly.
First of all, the antibiotic sweeps and destroys the normal bacteria. They're supposed to guard the vagina. So the acidity will go down and favor candida to grow. Then you have antibiotics actually quite irrationally used even in poultry. There's a lot of antibiotic use in poultry, chicken farming. And these birds are given a lot of antibiotics, and we consume them, more so the women.
So basically we're eating
the resistance,
no?
Yes.
And getting
comes back to the human.
The infection.
Yes. Yes.
Not that they're acquiring the infection sexually, but it is what they are putting in their system.
Exactly.
The antibiotics they buy from the pharmacy or the food which is.
And the clinicians and the health workers have not helped that much, because every time a woman walks into a medical facility with a vaginal discharge, they pump her with more antibiotics without even examining to know what. But candida is not treated with antibiotics. Okay. So all this is actually a vicious cycle.
So, but what is clear in light is candida is not an STD.
Exactly.
All right. So at least that has been brought out very clearly. Neither is a UTI an STD. Yeah? True. UTI is, like you said, UTIs are infections only of the urine system, and candida is, much as it's a common genital infection, it is not sexually transmitted. So I think that's one of the biggest points people should learn. But coming back to STDs now, what are the common STDs we know?
Oh, before we go to STDs,
yes.
There's something very small that we need to mention. There's something called bacterial vaginosis. Okay. Actually, it's as common, it could be as common as candida. And usually it's also an imbalance, like my colleague has said. It's an imbalance in the flora, in the microorganisms. So when this microorganism is overpowered, the lactobacillus, you can get other organisms growing. So you get what we call bacterial vaginosis, which presents like with a frothy, foul-smelling discharge. Yes.
Is it done? It smells like almost a fish.
Exactly.
Smell, the fish smell.
And usually the smell is increased or is exacerbated by sexual intercourse.
Okay.
Yes.
Yeah, one of the things that I usually tell women is that largely, of course, the vaginal tract is supposed to be moist. It's supposed to have some sort of discharge. It's a wet area. It's not a dry area. So if you find yourself that you're having an excessively abnormal, actually in terms of quantity, if you find that a discharge starts to stain pants, it could be abnormal. If a discharge changes color, then it could be abnormal. If a discharge is bloody or it has an abnormal smell, then go to a doctor. Those are some of the simple things. Actually, some women have a bigger volume of vaginal discharge than others, and they would come running to you saying that it is
I'm sick, they say.
Yes,
Okay.
and
Sometimes
even
it's okay.
women with IUDs, it's another common thing. Intrauterine devices can
we'll
also
come back
cause.
to a quick discussion on IUDs and their role in STDs, but more about this coming after the break. Please join us on our Twitter handles on Facebook, on Twitter. We'll be able to respond to each of the questions or those ideas or misconceptions you have about STDs and discharges, common discharges like candida or the likes. We'll be right back after the break.
You are watching the Doctalk Show. You are watching the Doctalk Show.
Welcome back. In today's discussion, STDs are the center of attention with lots of controversies and speculations around it. So I want to know from our guest doctors, what are the common types of STDs that the community suffers from? Dr. Sematimba, do you want to start us off on this?
We don't have so many that cause ulcers, but they are there. But commonly, the ones that cause ulcers in our setting include herpes simplex, which is caused by herpes simplex virus, usually type 2. And it causes a painful ulcer.
They're usually very painful, almost like blisters.
Exactly.
Yes.
It's painful.
And they keep coming and going.
Exactly.
They never cure.
I'm telling you, it's very painful. People who have suffered from those ulcers will tell you the story that it's painful.
Those are they call the genital ulcers.
Exactly.
Right.
Yes.
So herpes simplex causing genital ulcers.
Yes. So there are others like human papilloma virus, which causes warts.
Okay.
These warts appear like flowers, like dirty flowers. Yeah, they can cover the whole genital tract system, the external part, and it's not nice. It's not
a pleasing
oh
sight.
my God! When you see it, you don't. And the problem is usually because of the location of the wart. He will tell you that most women come covering themselves and they are scared of showing you what they have, but we can't help. And also we have syphilis. This is known to almost everyone. Syphilis causes a painless ulcer. It's painless. That's why.
But it's kind of fresh and like it has.
Exactly. It's elevated.
Like a real wound with water coming up, but no pain.
When you see the edges, they are elevated like this. So, but it's not painful. That's why the community usually, the people ignore because they're not painful. They can continue with their daily activities.
A very common thing that I think most African societies think if there's no pain, probably it's not a sickness.
Exactly.
So syphilis is one of the, I think it's the only STD which causes painless ulcers. If I'm right. The others are probably painful. So Dr. Chigundu, apart from the ulcers, there's the other side, the discharges, which I think are the biggest majority. What are these common infections that cause the discharges, which are STDs?
We've mentioned candida as one of them, but it's largely not an STD. Then you have other causes of discharges, which are really STDs, meaning they're sexually transmitted, especially chlamydia. Chlamydia is very, very common in the population, though it is underestimated. but it is one of the biggest causes of discharges, especially in men. Most common cause of urethral erosion and discharges in men. And then you have gonorrhea. Gonorrhea has not gone away.
Those two kind of go together, gonorrhea and chlamydia.
Yes.
Even in the treatments, they kind of treat both together.
Yes, exactly. Gonorrhea is kind of more aggressive than chlamydia, and we used to call it obulwadde bw'abazira. It was a disease of strong men, meaning that a man who had more than one woman was seen in society as so gonorrhea and syphilis somehow. If an ancient man didn't have gonorrhea or syphilis, was never suffered from gonorrhea, I would say you are not a yeah, but it is a very aggressive infection, and if a man has intercourse with a woman, within a week, they will start dripping. It's associated with aggressive erosion of the urine tract, and then formation of thick pus, which will be seen. A man with gonorrhea will scream in the next urine.
So it is a painful discharge.
Painful discharge causes pain passing in urine. Unfortunately, in women, gonorrhea does not give symptoms.
Though in men may actually they may say I'm itching. They may not describe pain, but we may say itching.
But they actually mean pain.
Yes, exactly.
But in women, there is no pain.
In women, gonorrhea goes for the cervix, and it's around the cervix, causes what we call cervicitis. So if you're not very keen, you might not diagnose it quite easily and quite early.
So in women, actually it causes.
And it causes cervicitis. First, it hits around the cervix, and then quickly ascends into the uterus, the tubes. It causes aggressive destruction of the tubes, and it's the number one cause of very bad PIDs and tube obstruction, tubal blockage, and infertility in females. So
this is what they call the blocked tubes,
yes.
is it?
Most times when we by the time we get to realize that it's gonorrhea, it has already caused havoc, caused damage that is irreversible.
Okay, so it's quite an aggressive infection.
Yeah. In medical terms, we say it's usually the acute form. It's acute. It causes aggressive erosion of most of those epithelial surfaces, and usually things have gone wrong.
Okay, so now that we know the most common examples of these STDs, I guess the next step is how one can tell. Can you tell that this is a discharge of gonorrhea, this is a discharge of maybe chlamydia, and this is a discharge of candida? What is the difference in those discharges?
Well, there's something we didn't mention. It's called trichomonas.
It's another
it's also some kind of protozoa, which is also another very common STD actually, which can have the same sequelae like others. We have mentioned chlamydia and gonorrhea. Yeah. So to your question, these discharges are actually different.
The discharges?
They are different actually. You can tell. And most cases, we can even treat without actually taking off a sample test, because sometimes they are so obvious that this is this. They will take the line and it's
so
very clear.
How can people know that this is gonorrhea? They should take it so serious and run for the treatment.
The easy thing is to, of course, it's quite difficult for women to know that they have gonorrhea. Sometimes they have acute low abdominal pain with a bit of fever, joint pains, but it doesn't necessarily cause a discharge. That's why it is treated as other, as UTI or any other problems. But with a man, when a man has gonorrhea, most times they will not survive for more than 3 or 4 days. The problem is they will not mention. They will treat secretly and transmit it to their partners. So the easy thing is to say if a man has gonorrhea or sees signs of passing painful urine or a flowing whitish discharge through the privates, you have to treat quickly, treat the partners, and try to make sure you don't transmit it to a generation. Otherwise, it's a very aggressive infection. It's actually one of the most common causes of tubal blockage.
Yeah. So we mentioned that these discharges can be, you can tell. For example, if someone has a greenish yellow discharge, greenish yellow, and foul smelling, it could be, most likely it's trichomonas.
Okay.
It can be frothy, green and yellow, between green and yellow, trichomonas.
Okay.
Yes, we said candida is like
It's
cadi,
a white,
spoiled
like
milk. Yeah.
spoiled milk.
Yes.
And very itchy.
Yes, exactly.
Then gonorrhea is very painful in men, painful discharge.
Yes.
Or in women, it can cause some
Sort of symptoms.
so
So again, gonorrhea can, because it can cause cervicitis, someone can come with a pink, brownish discharge, can be pinkish. Someone may think that's blood. I don't know. So because that's why some people ignore it, because it can come like.
It's not so severe in women.
Yes.
So it can be ignored and
Exactly.
progress
Or
into
sometimes
something
can be
else.
actually colorless and foul smelling.
So basically, what people should do if they have any sort of, if for example, if it's ladies, any change in the color, volume, or smell, they quickly go to the
That's the
doctor
most
for
important.
testing.
Yes.
So in women, it may be hard to tell if what gonorrhea is from chlamydia. In men, it's almost straightforward. Pain with a discharge equals gonorrhea.
The other thing that we should not forget and not go and mention is the issue of blooded discharges. They are discharges which are not spontaneous. They are sometimes discharges which are provoked by sexual intercourse. You have a brownish, bloody or blackish discharge. Usually these discharges signify bleeding from somewhere. And then any discharge in a woman above 45 or in a woman in menopause should be taken much more seriously, because most times these discharges signify cancer of the cervix, of the vagina, of the uterus. Okay. So discharges above 45 or discharges in a menopausal woman, a woman who stopped menstruating, should be taken seriously, because they are not usually innocent.
All right. So more about these discharges and STDs coming right after the break. We'll be right back shortly. But if you have any questions or comments regarding discharges or genital ulcers, wounds, how you can tell these two apart, you can just send them on our social media platforms, Facebook and Twitter. I'll be so happy to respond to each of your queries. Don't go away. We'll be right back.
You are watching the Doctalk Show. You are watching the Doctalk Show.
Some of the most common STDs in our communities include syphilis, gonorrhea, and chlamydia. And these infections, what is underlying them, what the similarity is between them, is the fact that they are sexually transmitted. So obviously, having multiple sexual partners might increase the risk of getting these infections. However, we want to understand what would happen if, for example, you get an STD and you do nothing about it. Does it cause any complications in the long run? So maybe Dr. Chigundu, should people take these STDs quite seriously, especially in the ladies who the infection may not be as, let's say, as aggressive as in the men, may not cause the pain? What would happen if it's left untreated?
Yeah, certainly STDs should be taken seriously, because most of the organisms that cause STDs, apart from candida. Candida is not an STD, but yes. The reason I keep talking about candida is because the public out there fears candida more than anything else.
They fear candida more.
Yes, it's not an STD. It's actually a little innocent, apart from causing a bit of discomfort and itching, but it is not as bad as these others. Okay. Yes, we should take STD seriously. In men, most of the STDs we've talked about would cause erosion of the genital tract, especially of the urethra, that tube that passes urine. And if they keep getting recurrent infections and healing with scars, they get what you call strictures.
Yeah, like,
strictures are the scars accumulate and they will close off the urinary tract. So most of those men will come back late after time when they can't actually pass out urine.
Or they pass out with difficulty.
Difficult or
So
painful.
it's like there's an obstruction to passing urine.
Yes.
Exactly.
Okay.
Again, in men, most of these infections will harbor into those organs that form semen, like the prostate and the seminal vesicles. They get comfort in those organs, and they can actually act as reservoirs, so that the disease becomes chronic. They actually are more like transmitters. Okay. Yes, so that is a big problem. It is very difficult to eradicate gonorrhea, for example, from the prostate, or even those glands called the seminal vesicles that form
And
semen.
these are in men.
Yes, and
so
these
the
are in
men
men.
would be like reservoirs of some
Exactly.
kind, passing the infection on.
Yes, and the infection can go deep down into the tubes that bring sperms from the testes, call it the vas deferens, and cause obstruction there. And these men will present with infertility after some time.
Most of these effects are replicated
Yes, in women.
in women, and basically women are, apart from getting these discharges, which are a very bad, like they inconvenience their day-to-day life, sexual life. Yes. The other big thing is these infections, when they ascend, when they go up the tract, they go on eroding, they go on infecting these organs. So from the uterus, you can get scars with a condition we call synechia. You can get scars, and then the uterus closes off. But that is not as common as in the tubes. Our biggest worry is when these infections ascend. They can cause blockage
The blocked tubes.
in the tubes.
Okay.
Yes, actually, most women will present with pain because of these scars in the abdomen, and of course, failure to conceive. And sometimes these infections are even they are contained, so the tube swells. Sometimes it swells with water. You just see water. It's called hydrosalpinx, or it swells with pus.
Is this the same as what sometimes in ultrasound women find things they call cysts? Are they the same? Is it the STDs which cause cysts?
Well, it's kind of different.
They're a bit
Yeah,
different.
they're different because the ovary is kind of not very.
Those are in the ovaries.
Yes, it's an
But these
ovary.
are mainly
Although
tubes.
they can also affect the ovaries actually.
reach the ovaries
Yes, these infections can reach the ovaries. Yes, so women may present with, apart from pain, they can have fevers, and this pain can be chronic, fevers and failure to conceive, or nausea and vomiting.
So
Because the,
basically kind
the
of
infections
very-
can be overwhelming.
Very severe infections.
Exactly, and they cause nausea. And actually, these infections can go as high as up to the liver.
Okay.
They
then
can
now
affect,
they
yes.
spread now into the body.
Exactly.
Okay. So basically, STDs are quite an aggressive infection.
The truth is, you'll be lucky. You'll be lucky if you catch the infection at that stage.
When it is still
early. But the truth is, most women we encounter in our practice have now got what we call PID. There is a thing in
PIDs.
town called PID. Every sonographer, every scan that comes, you see PID, just because they've seen
But
some.
is that actually true? Do they actually see PID? in the
No,
scans?
no. I think that's why I said that it's the thing of the
new thing in
sonographers
town.
in
Yes,
town.
they are people overdiagnosing
Yes,
it.
the actual thing about PID is that someone once had the infection. It created havoc, it got cured. Maybe they used antibiotics quite late. The infection got cured, but the infection left scars. The infection leaves scars which will trap the organs in the pelvis. You find the tubes caught up in the scars, the uterus caught up in the scars, and these
Intestines also.
and these continue to cause chronic pelvic pain. So most of these women keep going to the gynecologists with chronic pelvic pain. People keep giving them antibiotics which are not useful. Yet the actual problem
Yes,
is
it's
scars.
actually scars.
Yes, so we need to diagnose chronic pelvic pain or PID and treat it appropriately than giving women antibiotics after antibiotics. Then you cause more problems, vaginal discharges. So this is the whole sequelae of these.
Of an untreated STD.
Yes.
So what's now one of the most important questions as we conclude this discussion. Are these infections treatable, and can they be prevented?
Yes. Well said.
The STDs we're talking about, are all of them treatable? Or some are basically, once you have it, that's it?
So most of these infections can be easily treatable, but the unfortunate bit is most of our patients come late. They come late, sometimes they see the signs and symptoms, but they try herbalists, they try herbs, they try
eating garlic.
Exactly, they try eating garlic, some people steam.
And inserting garlic in the private parts.
Exactly.
That's one of the things.
Does that work, by the way?
No, of course not.
No, of course not.
They don't,
These people just try remedies they have heard about, but there's no science.
But they're just delaying the
Exactly.
infection.
So most of them, if caught early, they can be treated. But well said, these infections, we have to first diagnose them. And for example, pelvic inflammatory disease or genital infections, we easily take off a swab, high vaginal swab, take to the lab, do culture and sensitivity. Then the results come back when they're clear. This organism isolated, drug that treats the.
So those are the lab.
Exactly.
But basically, they can be treated. So what you're saying is, anyone who has an STD, any sort of abnormal discharge or abnormal wounds, go to the doctor ASAP.
Exactly.
All right. And as we conclude now, then the prevention, Dr. Chigundu, what can we do to prevent or protect ourselves from these STDs?
Being sexually transmitted, the first thing is to avoid acquiring the infections through sexual intercourse. So you either stick with one partner, or if you can't, then you have to use barrier methods, like condoms. But essentially, most of the STDs are carried sexually. And then there are those STDs that men don't seem to fear or don't know about, especially the human papillomavirus, the one that causes cancer of the cervix and cancer of the vagina. It is actually almost now number one. Yes, cancer of the vagina, sometimes, rather cancer of the cervix, sometimes I joke that it's an STD.
Could it be an STD?
In a way,
it's a disease because it's caused by something else sexually.
But the virus,
actually, more than 99% of women who have cancer of the cervix acquired it through a virus called human papillomavirus.
Okay. So that makes it almost an STD.
And in men, it can cause cancer of the penis or cancer of
later on.
The throat or
exactly.
Yes, the unfortunate bit is that men transmit it more to the women and do rarely get those complications, but they can if it's not eradicated. Okay. That's why things like circumcision are very important. Maybe lastly, telling women that every time you have a vaginal discharge, please visit a gynecologist, because most of these vaginal discharges are as simple as putting a speculum, examining properly, seeing the nature of discharge and treating it, other than going to the pharmacy to buy antibiotics.
So
antibiotics are not friendly to a woman.
They will increase the
way.
candida.
They are not friendly to the vaginal tract.
All right.
Yes.
Untreated STDs equals complications such as infertility. So you have it, you've heard it from our experts in studio. Thank you once again for taking us to this discussion. We'll see you next time on the Doctalk Show. Please send in your comments, your questions on our social media handles on Facebook, on Twitter. We want to answer each and every question you have regarding STDs or regarding candida or any of the infections you've had on the discussion. We'll see you next time on the Doctalk Show. Goodbye.